And please keep in mind, if you have any questions throughout the session, utilize the chat box function, and we will have a Q&A session at the end. And also, we'll go ahead and introduce our speaker. So today we have Debra Myhr from Physical Therapy and Balance Centers, Pineville. And today's topic is falls in your health, how to stay healthy and upright on your feet. And I will go ahead and turn it over to Debra here, and she can tell you more about herself.
Good afternoon, everyone. I am Debra. I'm a physical therapist. I have been in the Charlotte area for about almost 7 years now, and I've worked at some of the bigger hospital systems as well as some other smaller places. And we are here to be your holistic approach for some of this stuff. So we are a physical therapy clinic that is new to the Pineville area. We started in July of 2022. And we are slowly but surely getting the boots on the ground, and people are knowing that we are here. We are one of 7 clinics that are in the area that are open from physical. So everyone is a little bit different, but everybody has the same philosophy of 40 minutes treatment slots, as well as looking at your balance and vestibular and everything else that was required about physical therapy. So a little bit more about us. Today, what we'll be continuing is like an introduction to what we can do for you, some fall facts, some balance information, as well as treatments, and then it's kind of the top 10 fall prevention tips to kind of look at your house a little bit. And hold on one second, because apparently I have it on going fast. And so the next one we're going to do, so basically I'm the clinic director. We want to get our patients to get back to loving their life, and our goal is that we want to have the ability to kind of be a place to come for answers to. So if you have questions about what's going on in your diagnosis or anything like that, we can be that person and that you can contact even on top of your primary care physician. We do free consultations as well as other kind of little checkouts just to make sure everything's going okay. So basically what we want to focus on is falls. Falls are 60% happen at home. Okay. That's a lot of people don't realize that. I somehow have to turn that off, but I'll keep on playing with it. The other happens to happen in the community, which is what more people are more worried about because they feel that their home is safe, but their home can be just as dangerous. If we look specifically at our houses, we want to look at where we have them the most. Your living room and bedroom are your top 2. And then, much to everybody's surprise, bathroom is not on the top of the list, but that usually is where people kind of realize they need help the most. So those are kind of big things that we want to look at, and we want to make you safe. Every second of the day, an older person will fall, and basically up to 1/3 of adults who live at home will have falls, and every, their nursing homes, half of them will have, and 2/3 will be on the other section that has them. So falls are pretty happening, and we need to make sure that they're not happening, as well as we want to prevent them. So falls are inevitable. Eventually at some point in time there will be an accident that occurs, but we want to prevent all the unnecessary falls as possible. So if we look at this, 1 out of 5 falls causes a serious injury, such as a broken bone, head injury, things like that. 3 million people are treated in the emergency room a year about this. Another big thing is that 95% of hip fractures are caused by falling. And it could be that the fall happened because of a fracture, or the fall made the fracture happen. So we want to look at those things, because those are important things that might be osteoporosis or other ailments that might cause that. The other thing that's big is that it's caused a ton of money. The more falls we have, the more people we have, the more medical bills there are. If we can keep you safer and upright on your 2 feet, we can keep your bills down, as well as prevent the ability of kind of getting those traumatic brain injuries or anything like that. If we look at balance is controlled by 3 systems. One that I kind of like your gyroscope is your inner ear. So you have 3 canals like this picture shows over here in this purple figure. And those 3 canals kind of tell your body where they are in space. So that is kind of a big, kind of the symptoms that you might get with that is like the world is spinning, or you're spinning on the world, or you feel really nauseous. People can have those symptoms. The other things that you can have is vision issues, or what we call the somatosensory. So when we look at somatosensory, that is your body's feedback system. So it can have sensors in bones and in your joints, as well as your muscles and tendons. And these all feed back to the brain to kind of tell you where you are in space. So if you're sitting in your chair at your computer, your body is sending back feedback that your knees are bent to about 90 degrees and your hips about 90 degrees. And so that's telling you I'm in a seated position and I'm supported because I feel the sensory on my butt on the chair. So that's that somatosensory system. Excuse me. Balance can also be very important with our deep core musculature. When we look at the definition of balance, it's an even distribution of weight enabling someone or something to remain upright and steady. Okay. If we don't have a good foundation, similar to if we look at houses, if houses don't have a solid foundation, then those houses are gonna fall over. Same thing with our bodies. So if we don't have the good obliques, the transverse abdominis, which is the deep core muscles, your back muscles and your hip muscles, your core is not going to be strong, so you can't necessarily maintain that upright and steady position and that even distribution of weight. Okay. Balance can be caused by disruption of balance, can cause a lot of things. One, we look at vision. Vision is huge. A lot of people over the age of 40 to 50 can tend to have bifocals and trifocals. And if you've ever looked at them, if you think about it, if my glasses are, here are my glasses, that bottom third usually is your magnification portion, correct? And so if you're looking through your glasses and you're looking down at your feet, that area is going to be the blurry area that we want to look at. I am a huge proponent of people having glasses that they walk in, as well as glasses that they might sit at a computer at or go to the grocery store, things where you might have to do both long vision and near vision. Other things that can affect your balance is if you have glaucoma, cataracts, or macular degeneration. Your eye field changes with all of those diseases, and that can limit how much you see out of your eye if you're not being careful about it. The other thing that we talked to, core and leg weakness. Other things that we look at is poor posture. If you're already in a kind of a bent over posture, it's going to be hard to get you stable because your center of core is off of where it needs to be in order to be stable. The other things is coordination. You know, do you have trouble lifting up your feet to get onto stairs? Do you have trouble lifting your feet up to get in and out of a car? Do you have a tendency to shuffle or stumble because maybe you're not crossing midline or crossing your feet over each other? There's a lot of different things that can happen. These are similar to some of our movement disorders like MS and Parkinson's and that sort of thing. The other things that change are longer reaction times. So, you know, if you look at a 16-year-old, their reaction time might be that to something that comes into their view. As well as we age, it might take us till about right there that we see that thing that's in our way. And we want to look at that stuff too. The other thing is medications. Medications can cause a lot of side effects. Those side effects can affect your balance, or maybe you're taking medications to decrease the shakiness or the dizziness, and those medications can help. So we want to see what is new. Say you recently got diagnosed with what we call BPPV or vertigo. We want to look at what medications you've been taking. A lot of times a change in medication can also alter how your body's doing. So you might not have realized you had a side effect, but now you do. So things like that, we can look at that as well, and kind of determine, did that new medication cause some of this weakness or dizziness, or maybe difficulty breathing or things like that. Or we can also look at it as, is the medication doing what it's supposed to? Is it a high enough dose? Say you're on a medication to stop the trembling. Some of those things, maybe there needs to be an alteration of how much those drugs are in your system. But what I do want everybody to know is falls are common. They're preventable and they're going to be inevitable, but they don't have to be inevitable. The other thing is that we want you to know that don't be afraid to tell somebody you have falls. When they happen, it's important to tell somebody, because when you don't tell anybody, that's when you might go undiagnosed with something or you might have more issues. So we want to get you guys as knowledgeable as possible. The other thing that you can look at is what we are going to do for treatments. Oops, sorry, I'm not good at this thing sometimes. Treatments, what we look at is your deep core strengthening. So we want to build that foundation first. So we want to get you strong enough so you can support your body. The other things that we want to work on is weight shifting, relearning where your body is in space. I might have you shift from side to side or front to back while you're standing so that you can feel where your body is in space. If you go too far one way, you might feel unstable. If you go too far backwards, you might feel unstable. But what we're trying to find is where your best point of equilibrium is, and we can get you to kind of find that so you can keep static. Next thing we're going to look on is balance exercises. It might be single leg exercises, or what we call Romberg, where your feet are next to each other, or it might be tandem, which means one foot's in front of the other. Things like that. We're going to challenge you with that. We're going to challenge you with head motions to kind of perturb you. So we're going to try to use self-perturbation, which means that you're doing movements that are going to knock you off balance. Those things are going to help out with relearning where you are in space. The more you are working on your balance and challenging your system, you're actually learning your system better. So it's a very much learned process, and it's a lot of practice. Practice with this kind of work is what's going to show the most carryover. Other things that we might do is cross-body movements or anti-rotation movements, so that we're really working that core and you're able to coordinate across the body as well as through that midline and up above the midline and vice versa. I am a huge proponent of doing obstacle courses. I really like to challenge my patients in knowing what might happen out in the real world. We'll take you through a walking scenario in the shopping center we're in, just to practice going up and over curbs that you're not used to, that might not have handrails or things like that. The other thing to know is that there are other programs out there. There are people that can do LSVT Big, which is a program that technically I think has to be 4 days a week for 60 minutes each time in order to be considered LSVT Big, but it's a program that works on encouraging big movements, specifically with movement disorders like Parkinson's. And you're doing a lot of cross-body activities, big movements, big, large numbers. So you're saying the words and that sort of thing. The other things that are in the area that a lot of people with Parkinson's or other movement disorders do is rock steady boxing. Maybe they might take the matter of balance class, which kind of teaches you similar to what we're learning today. But the best thing that we can do is any of our treatments, anything that we're doing to help you with this balance, is we're also going to challenge all three of your systems. We're going to look at your ears, we're going to look at your eyes, and we're going to look how your body's feedback system is. Yet again, if we don't challenge them, they're not going to get better. So that's why your balance program is going to be all over the place in regards to single leg, stable and unstable surfaces, maybe working on movement over an unstable surface, things like that. So we really practice and preach what we're doing to get you ready for real world environments. Okay. And the last section of this is going to be how to keep you safe. These are the top 10 things that we can do to keep you safe in your home, in the environment, in your community, churches, wherever else you like to tend to go. So the number one thing that we can do is remove clutter. I know as we change houses, or we've been in a house for a long time, you have a lot of clutter, or there might be a lot of different furniture you might need to move out of the way to have a better path. A lot of people will kind of become minimalists and kind of keep as much stuff off to the side. You also might want to look into, if you do have kind of the deficit with some of your big step lengths and stuff like that, maybe you get little vinyl decals of footprints and you put them down a long hall, and you can make sure you're making nice big steps for all those activities that you want to do and get better at. So number one, remove the clutter. Okay. Number two, improve the lighting. You know, if you don't have a very good lighting in your house, you're probably not going to see it very well. And you're not going to see some of your obstacles, or if you have a bath mat, which I hope you don't, other than when you're getting out of the shower, or you might have some other things going on, like maybe you need a night light in the bathroom or on the way to bathroom if you go to the restroom at night. Maybe you need an extra light if you have to go all the way to the kitchen to get water in the middle of the night. These are all things that you might want to look at in your house. And there are a lot of cool new things where you can get motion sensor stuff. So if you come into the area, it turns on a light. I've been seeing a lot of people adding motion sensor lights underneath their vanities in the bathroom. So it's not a light that's on all the time, but once they cue the motion sensor, they come on. So lighting is another big one. The other thing is tripping hazards. So slippery rugs. So those little tiny ones that are so pretty, but not so great for when we get older and when we have walking issues. Any loose carpet, or if your carpet's kind of rolled up because it's been there a long time, have it re-stretched so it's nice and solid for you. The other thing that you want to look at, and maybe if you have steps, is getting glow-in-the-dark stripping for steps so that you're aware of them. Maybe it might be just a one step down into a bathroom or a kitchen or a living room. But if you're not paying attention, you might not see that in the dark. Therefore, adding that glow-in-the-dark strip, it'll help you out a little bit. Next thing is handrails and grab bars. I cannot stress this enough. It is no shame in your game to have some grab bars in that bathroom. It's better to have more than less, and better to have them in good areas that you will use. I always recommend people, if they're going to add some, to kind of play around with the position of them in order to figure out what's best for them. Maybe you have your shorter stature person and your husband's really tall. You might want two different ones at different heights to make it optimal for both of you. Having handrails or something to grab onto add in your steps and stairs in the house. These can always be removed if you don't need them, but they're always great if you do need them. The next one is make it non-slip. So if you do, when you do have shower and bathroom rugs, make sure they're non-slip and that they do soak up the water really well so you don't have any wet surfaces. If you have the ability to put some in the tub, putting down the little strips that make it so it isn't slippery, that's awesome. I would also recommend getting a chair for the bathroom. It's a lot easier to make sure that you're not going to fall when you've got some seated surface that you can go to as well. And the next ones is always making sure you have your eyes checked. I had a patient recently that I saw her for a consultation, and I was like, you might want to get your eyes checked. When you have trifocals or bifocals, you're going to have a limited amount of view. And when she went back, she said, I was so surprised that I've now been diagnosed with cataracts, and that's why I felt uneasy when I was walking. So sometimes the fix can be super easy by just checking out your eyes yearly. Or if you feel like it's changed a lot and it hasn't been a year, go back. I was like, they'll recheck those eyes for you if you feel like you're having struggles with it. I'd much rather have good vision than no poor vision. The next one is have someone review your medications and vitamins that you take. Are there any side effects? Are there any side effects that might be present in both of them, and that's what you're having issues with? It could easily be maybe you added a new medication, it's acting poorly with another one. Everybody's body is so different that every person's going to have different side effects. Case in point, we saw it all with COVID. When you look at COVID, everybody's response to COVID was different. It's the same thing with medications. When we look at our different medications, everybody's going to have a different reaction to it. So what is good for you may not be good for somebody else. So looking at your medications, if you need somebody that is a clinical pharmacist, there are people in the community that can look at your medications and make sure everything's okay outside of your CVS or your Walgreens, whatever pharmacy you go to. There are pharmacists that live and die over looking over these things to make sure that you're on the right stuff. And they might be able to find something that you might have a side effect with you didn't realize. The other thing is doing strength training and balance. Strength training is very important as we age. We tend to be a lot more stationary, and when we do strength training, that helps with our bones, it helps with our muscles, and it helps with our balance. The other things that I'm a high proponent of suggesting is yoga and Tai Chi. Now, it doesn't have to be yoga, traditional yoga, and you're doing pretzels and handstands and those type of things. It might be as easy as a yoga in a chair. Yoga in a chair is a great way to start. There's a lot of senior places that do these in the area. If you need help finding one that would be good for you, give us a call. We don't mind looking into it for you. The other good one is a Tai Chi class. Tai Chi works on very slow movements. It helps with arthritis. It helps with balance and things like that. All right. The next one, and this is my big soapbox, is I feel like everyone should have a physical therapist. And I say this as all of us have dentists, dermatologists, your primary care physician, maybe you have a cardiologist. In the cases of having Parkinson's, you probably have your neurologist. These are all people on your team that you can call and ask questions to. What people are usually missing is that physical therapist. Now, it may not be for directly related to Parkinson's things. Maybe you picked up something and now your elbow hurts from lifting something. These are all things that if you had a physical therapist that you trusted and knew that you could call, you could have a consultation, or you could just go give them a call or an email and say, hey, I did this weekend and I'm having some issues. And what do you think it is? Or do you think this is something I need to go see a doctor about? Having that person is immensely important for all of us as we continue to age. I would even say 30-year-olds should have a physical therapist, and maybe even getting checked. Maybe have your strength test once a year. Maybe have your balance looked at once a year. There's lots of things that we can catch that if we caught early enough, you might not really need a lot of therapy for, but you might need some assistance in the process. So that's what we're here for. And number 10, have a home evaluation. I can't stress this enough. Have someone that does this on a daily living go through your house, see what they can assist you with. Maybe they can give you a different type of rug, or maybe they can get you a different type of grab bar that might work better in your house. Maybe you rent and you need to find things that aren't going to damage the walls or anything like that. These people will know what to get, and they know the products that are the most safe. You know, sometimes you can go buy the suction cup grab rails at Home Depot, and they might be good enough, but they might not be great for everybody. So I highly recommend that. If you guys have questions for people that you might call for that, I am able to put you in connection with some of those people. One of the ones in the area is Green Mobility, and they will come out to your house, assess your house, and see what you need. And they may give you a couple options of how to make your house safer, and how to age in your home appropriately. If you want, you can kind of take a quick test for yourself. This is a great way to kind of give your kind of self-assessment of your balance. Kind of see how many yeses and how many nos you have of this. Kind of test your, look at your fall risk assessment. Where are you? If you're anywhere in this yellow, orange, and obviously up in this more red orange, you should have it looked at. I would even say that if you feel in the 1 or 2 range, there's no harm, no foul coming to go to a PT to kind of have someone look at your fall risk abilities and to give you some suggestions to keep you from falling. Every 11 seconds, we have an older adult that's treated in an emergency room because of fall related injuries. And so we want to make sure that you guys are as safe as you can be. And so we can push you to get you better even more. I'm gonna leave that up for a little bit. If you guys want to look at that a little bit longer, I'm gonna pause for a little bit just so you can kind of look through those questions, or I can come back to it too. So I'm gonna pause for about 5 to 6 seconds. Okay, and the next page, we don't all have to become flamingos, but working on our balance daily, similar to what birds do, standing on one leg. You can do it at the kitchen sink. Maybe after you brushed your teeth, you do in the bathroom sink. Practicing balance daily is important. It's nothing I can stress more than will improve your ability to kind of catch yourself and know where you are in space if you keep on practicing. And then I'm to the point where if you guys have any questions, I am for you. So let me have it. Does anybody have any questions?
And if you have questions at this time, you can come off of mute.
I'll go back to that page that had the questionnaire if anybody wants to do that, in case they're curious of where they fall. But yet again, we are here Monday through Friday, and we have availabilities for consultations if you guys just have questions, maybe about different things that you guys can try for treatments on your own, or maybe the exercise classes, kind of like a Tai Chi or the rock steady boxing and that sort of thing. I'm an open book in that regards. I would much rather answer questions and help you stay on your 2 feet than not you guys learn the information.
Any last questions before we get off here? And again, you can take your self off of mute. You don't have to use a chat box at this time. If there's no other